We are now joined live with the Medical Director of Elon Health Services, Dr. Ginette Archinal. Dr. Archinal, good morning.
Good morning.
To start off, so we're seeing active case numbers starting to rise at an increased rate. What does this tell us, and what are you watching for day to day?
It is not surprising that case numbers are increasing. I think one of the things that Elon has done brilliantly is that it's taken this long for our case numbers to rise. Cases are rising in the county, cases are rising in the state, cases are rising in college campuses all across the country. This was expected.
And Dr. Archinal, being one of the only doctors on the Ready and Resilient Committee, do you feel the added pressure of providing guidance for the university?
That's a great question. Actually, I don't feel much pressure at all from that, because decisions that the university make are not my decisions. My role on the Ready and Resilient is to give the medical facts. I don't give my opinion, I give the facts. I'm not the only source of medical advice for the Ready and Resilient Committee. Obviously, the local health department is heavily involved, as are the people at the Cone Health System. And the Ready and Resilient people are very respectful of what I say. It's a very good give and take. We all come at our approach to what we would like to be seeing on campus from different aspects. I can't talk about the academic aspects. I can't talk about the administrative aspects. I can only talk about the medical aspects. That's my role, and I feel very respected for that role.
So, Dr. Archinal, if my roommate were to be experiencing COVID-19 symptoms but has yet to test positive, should I stay home out of caution?
No. And that's a great question, Bella, because I think there's a lot of confusion around who should be quarantining, self-quarantining, isolating. If you have been a close contact of a proven positive case, so that means you have been within 6 feet for more than 15 minutes of somebody with a positive test, then you need to go into quarantine for 14 days because the incubation period is 14 days. There are lots of other viruses around apart from COVID. If everybody with viral symptoms who was not suspicious for COVID had all of their roommates, friends, everybody else go into isolation the minute there was a sniffle, the entire campus, including most of the faculty and staff, would probably be in isolation. The reality is that only if you've been exposed to a proven case should you isolate. Now, if you're sick and you don't know, that's why the guidance on the self-screening app says, stay home that morning, speak to Student Health Services. We can do a virtual visit. If your symptoms are suggestive of COVID, we'll send you for testing. We see people with allergies, we're seeing people with strep. I'm sure we'll soon start seeing people with mono because it's that time of year. All of these things give respiratory symptoms similar to COVID. That's why you get diagnosed and assessed and don't just assume that you need to be isolated.
Perfect.
Thank you so much, Dr. Archinal, and thank you so much for joining us this morning and for taking the time to speak with us.
My pleasure. Thanks so much.
Thank you.